Okay, so I would start by introducing myself to the patient, and then I would begin by identifying the patient with two identifiers. So I would look at his hospital tag and ask him for his full name and his date of birth. And then after that, I will begin by explaining to the patient why this procedure is happening. So for this reason, it's that the patient is unable to void himself. So the normal amount of urine that he is unable to void is 630 milliliters. So since he's unable to void it himself, a catheter must be inserted to void the urine. Okay, so before I begin, I'm gonna wanna make sure that the bed is at about the height of my hips so that I'm not leaning over very low, and I'm gonna wanna make sure that I can easily insert at a comfortable level, and I'm gonna wanna make sure that the patient is comfortable. So I'm gonna start by putting the drape over here, and then I'm gonna pull down the blanket. And you're gonna wanna make sure that the patient's in a supine position with his legs abducted, so bent upwards. And then you're gonna wanna open the gown to be able to performing hand hygiene. And so I have my kit ready here. So before I begin, I'm gonna perform hand hygiene. And then I'm gonna start by opening the kit by only touching the outer corners and making sure that the shiny part of the drape is on the bottom. So I'm gonna try and touch the drape only by the inner corners to remain sterility. And then I'm gonna take this drape and again make sure that the shiny part is on the bottom. So I can do this without my gloves on. And then this will be placed underneath the patient. Okay, and now I'm going to want to put on my sterile gloves.
Do you want to do any gloves? Sure. I'm just going to do the whole shebang. I'm not going to do like hi, my name is this little thing. I'm just going to do all the vital signs. We don't have that chart, no, we'll do it. Yeah. We're allowed to have, no, we're allowed to have a clipboard to write things down. Yeah, that's what I was going to do. I was going to see if I could write down like inspiration and then the only thing is I forget when I'm.
So once your sterile gloves are on, you're able to touch anything in this field. So you're just going to want to take everything out. And then you're going to want to put the fenestrated drape over top of the patient's penis. Again with the shiny part.
I'll use your other one.
Okay, so now someone is just assisting me to open the catheter. So I'm going to take the catheter and put it in here. And in order to make sure the catheter works, you're going to want to insert the solution to make sure that the balloon inflates. So you always want to see how much solution is in before, so it's 10 milliliters of saline solution, and then you're going to want to insert it in here. And this is just to make sure that the catheter is functioning, and so you're going to want to slowly push on the syringe and watch as the balloon inflates. So as you can see, the balloon is starting to inflate. And then you inspect the balloon, make sure that there's no leaks or rips. And then you can just take the water or the saline solution out and make sure to do this slowly. Take your And then to prepare for the catheterization, I'm not going to do it right now as this is just a mannequin, but you would open the loop and then insert about 3 inches of the catheter into the loop, lubricating it so then it can easily slide into the urethra. And then once you're done with that, you would just dispose of it. Okay, so now I'm going to grab the shaft of the penis with my non-dominant hand. So once I grab the shaft of the penis, I know that this hand is no longer sterile, and so this is my only sterile hand. So I'm going to begin by taking the cotton pads soaked in iodine solution, and I'm going to use 3 of them and clean the tip of the penis with about 3 different ones, and each time just going in a circular motion. You're going to want to do that 3 times to ensure that it's clean. Okay, so, and then since we don't need these anymore, these can also be discarded. Okay, so now the catheter is ready for insertion. So again, you're going to want to just keep your non-dominant hand that's already lost sterility on the shaft of the penis. And then you're going to want to grab, you're going to want to hold the catheter about 3 inches away from the tip. And then you're going to want to slowly insert into the shaft of the penis, making sure that it's straight so then it slides into the urethra easier. And you're going to want to do this in a slow motion and be aware if the patient feels any pain and ask them if they feel any discomfort. And if you can't insert the catheter, then be mindful that it's very common for men to have prostate issues, so you might have to take the catheter out. So to begin, you're going to want to slowly insert. And you're going to be inserting the catheter until you see urine. So once you see urine, you can then inflate the balloon slowly. Okay, so now you're going to want to pull the catheter out until you feel resistance, and that's when you know that the balloon is in the urethra. So you're going to want to do that slowly. So as soon as I feel resistance, I know that the catheter has been properly inserted. So now I'm going to be disposing of all of the materials that are not needed. And then it's important to document all findings during the procedure. Okay, so now I'm going to be discontinuing the Foley catheter. So prior to this, I performed hand hygiene and put on a new pair of gloves. So now I'm going to start by deflating the balloon. So to do this, I'm going to have to insert the syringe in here and slowly drain So once that is done, I can now slowly pull out the catheter, and I need to be cautious if the patient is feeling any pain. So while doing this, I grab the shaft of the penis and I slowly coil the catheter around my finger. Okay, so now I'm gonna deattach the catheter from the urinary bag. So by doing this, you just pull it off. Okay. And then you're going to want to discard of the catheter. So you just take this and then discard it in the proper garbage. And then it's time to take the drainage bag. So you detach it from under the bed. And once you have the drainage bag, usually the bag would be pretty full, but in this case it's not. And you would just inspect the urine, inspect its color, the amount of urine, so the urinary output, the smell, and then you would properly dispose of it into the toilet, and then you would properly dispose of your urinary bag in any sort of trash can. Okay, so now I'm going to be taking off these drapes. and also discarding them in the proper bin, which would be the garbage. And then I would just re-drape and pull the blanket up. And the necessary peri-care would be provided after the procedure is done. And then you're gonna wanna put the arm rails up as they were before for safety. And then you're gonna wanna lower the bed. And then it's necessary to now finally take off your gloves and dispose of them properly. And it's important to perform hand hygiene. Instead of using hand sanitizer, it's important to actually wash your hands, as your hands have come into contact with bodily fluid, and hand washing is more effective of getting rid of the bacteria that you've come into contact with. And it's important to document everything, all of your findings during the procedure, and it's important to take note of Mr. Mancini and his urinary output, making sure, asking him if he feels pain at any time to let us know, and that it might be painful the first couple times he voids, and if he feels any pain, it's important for us to know about it.